Do we know what we're talking about?
Season 3.
Hi, I'm John Stevens.
This is Matt Russell.
This
And this is Pod Have Mercy. And your gut, what do you think?
So you're supposed to start by asking me how I'm doing.
Oh, so no, I didn't know we were recording. John Stevens.
No, there's a reason why. I want you to ask me why I'm doing.
John, how you doing?
I'm not doing well right now.
What's going on?
Because I just got off this call with Marc Boom. This is depressing.
Really?
It is.
I was hoping there'd be some good news. Like, what happened?
I don't know what happened.
What happened?
So we just got off a call. There was a group. I put together a call with Marc, and there was a group of us. And so I recorded some of it, and I wanted to share it on the podcast today and talk about some of the stuff as well. So we're going to watch the sort of the first part of the call, where Marc just gives us it's gosh, how long was it? Maybe 13-minute update of kind of where we are, what's going on, trends and all that stuff for Houston. That's the thing. People listen in different places. This is Texas Medical Center data and Houston Methodist data points. But I will add that's something that you won't hear in his particular video, that we did have a conversation after this back and forth, that he's hopeful that that Houston is kind of on the front end of what we're going to see nationally. What that means is there's a lot of models out there. This thing could keep going up here. Okay. But he thinks in the rest of the country you're going to see them follow kind of the trends we're seeing. And he's hopeful that we're going to see the apex and go on. And so when everyone else is dealing with it in really difficult ways, hopefully we'll be on the other side of it. Now it's just guess at this point.
Is some of the alarm is that there's been such an uptick quickly of cases, or what's the cause for alarm?
Well, yeah, I mean, when you look at these graphs that he'll put up here, I mean, the rate of ascent for hospital admissions is much steeper than we saw in the winter. It's like last June when this thing was just like going straight up. Okay. And you know, he's got models. He's got several different models. One model like puts us at like where we were in the summer, and he's got one model that's like almost double that, which is really scary. And he's very careful to say, look, these are just models. I don't know. But it's just, I don't know, man. This is concerning. So we'll listen to him first, right?
Great.
And then
we'll get back and we'll have a really great discussion about.
He'll come back and lament.
Yeah, I wish things were better. So if it's okay, I'll show you a couple data points, because sometimes a picture's worth 1,000 words. So give me a second. You should now hopefully see my screen. And This is the Methodist website data that we put up there. This is a day in arrears. It'll get updated in probably the next 10 minutes or so, usually around 11. So that number on the right, which is the blue line, which is total number of patients in house, is 479 as of last night. This morning it was in the 490s. Yesterday during the day it was around 500. So it tends to be a little higher during the day and we discharge. But bottom line is, I mean, it's pretty striking what's happened here. Unfortunately, in the course of really 3 weeks, we have exploded in the community. And so up until really, right at turn of the month and even a week or so into the month of July, we were doing okay. And what's really striking is how steep this curve is. It looks just like last summer. It doesn't even look like what we saw in the earlier days of this winter surge. It has been just straight up, as you see. More inpatient, regular beds than ICU, which is good. So it's not totally taxing ICU, but we're seeing a rate of increase that's pretty dramatic. And I'll scroll down to the testing data. Pay attention to the blue lines for a second, not the orange, and I'll come back. We have seen a rapid increase in testing numbers. I mean, 200 a day, basically, which we haven't seen since mid-January. Basically. So everything's kind of rolled back and, is a 4, 5, 6, 7x over where we were in mid-June. The orange line is positivity percentage. I wouldn't pay that too much attention. It clearly has spiked, but what we had happen was in the community, a lot less kind of regular testing was happening because things were so good. we and all the other health systems stopped testing vaccinated patients on admission. So that whole group of people weren't being tested. And then this hit, and it was all these sick people. It shot up the percentage rate. Now we've turned back on testing everybody again. So I'm not 100% sure if that's a true bend, which I would love it to be, or if that's just, an artifact of data now that we're starting to test everybody again. I think it's unfortunately a little bit more the latter still. On our own internal data side, though, I mean, the one kind of piece of hope I have is, and it's a very, very early indication. Give me a second. I'm just trying to find it here for y'all. It's in a different program. And that's just, if I look at the 7-day, oops, that's the wrong one. Hold on. So that's just data that was supporting it. Hold on. If I look at the 7-day average, there you go. Do you see now a line graph? Yeah.
Yes.
So if I look at the 7-day average number of admissions we've done, again, this is what leads to the aggregating census, because people stay 6 or 7 days on average. But you can see it just started shooting up, straight line on a set. And again, this is a rolling 7-day average. So it'll smooth out some of the bumps. Last 3-4 days, it flattened a hair. Now we had one really, really high day pulling up. And so I'm not 100% sure, but maybe we're seeing a little mitigation there. And then the final thing I'll share, going back to the internet, is so if I go to the Texas Medical Center numbers, here you'll see aggregate data across the TMC. This is weekly, so this is community positives that now are, well over 2,300, kind of what we hadn't seen since, on the way down, kind of first week in February. On the way up, it was kind of Thanksgiving time, and as high as what we saw last summer, obviously with the, proviso that last summer, I think, testing wasn't being done as effectively. Same thing in the hospitals. So 246 admissions per day average across the TMC, and it'll go up this week for sure from what I'm seeing. And if you look at the census in the TMC as well, you can see that at the bottom, especially the entire pandemic, each kind of color section is a different month. And you can see how it's accelerating. It's nowhere near the summer peak yet, but we're all about 2/3 of the way there. So it has moved on us very, very rapidly. So that's the setting we're in. So why is this happening? First and foremost, the Delta variant, and happy to talk at length about questions you might have about the Delta variant. But, the bottom line is this thing has a spread factor, the R that everybody hears about, of 6 to 7, most likely. Not quite, the chicken pox that the CDC was saying, which is probably 8, 9, 10. But getting up there in terms of pretty infectiousness, and the regular flu is 1.3, so this is dramatically more spreadable than the regular flu, and it's at least twice as spreadable as the last variant we were dealing with. So that's why you're seeing it spread so quickly within the unvaccinated population, in particular. So that's reason number one. Reason number two, I already alluded to, is we have a lousy uptake of vaccines, and there's no question you're seeing the surges happen in the states that have lower vaccine rates right now. It just is. And so there's more susceptible people. It doesn't mean the other places aren't going to follow. I actually think they are, because they still have plenty of unvaccinated, but we just have a lead on them. And then the third reason is that, if you look around the community, we're not doing anything to mitigate virus right now, right? Compared to behaviors that were present and things that were present in the winter, almost none of that's there. I've seen some change in the last week as people are waking up and saying, oh, crud, this is here again, but hardly the kinds of protections we had in place previously. We've also seen a small uptick in vaccinations, which is good, but growth off of a very, very low level. And so most of the unvaccinated are not exactly rushing back to the vaccines right now. So those three things together are causing a great deal of difficulty. I will say I am hearing levels of, I don't want to say panic, just levels of concern among other health professionals, particularly the more vulnerable. I mean, not to pick on them at all, but Harris Health is very under-resourced. They're small. They, oftentimes are sort of the canary in the coal mine. They're really struggling right now. I haven't seen them struggle like this since last summer. And in part because all of the hospital systems don't have the staffing that they had a year ago, whether that's regular staffing just because of attrition and people leaving and people retiring and all the difficulties of this pandemic, whether it's people who don't want to take extra shifts because they're exhausted after 18 months of this, or whether that's now, the governor in dishes basically said, hey, you're on your own. We're not getting you supplemental staff this time, even though they did this Thursday, Friday, even though previous two surges, there was a lot of state provided supplemental staff. So some of the less resource or more vulnerable hospital systems really starting to feel it. And so you're going to see that be a storyline here, I think, pretty soon as well. So then the other big question I know, and then we'll get to your Q&A, you're going to ask is, well, what about breakthrough infections, right? That's all the discussion right now. First, I would caution everybody to remember that the story about the breakthrough rock star or the breakthrough politician is a very sexy story, and the press can't help themselves and they will write those stories every time, right? So mentally, all of us kind of hear breakthrough, 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 when the reality is it's not as bad as it would seem from that. That being said, it's worse than I would have liked it to be. So to be completely transparent, in other words, we're pretty sure, nobody has perfect data, but we're pretty sure we're seeing significantly more breakthrough with Delta than we did with the previous ones. Now let's clarify that, right? The original vaccine studies against, prior to even the Alpha variant, showed 95% efficacy at preventing infections, symptomatic infections, 99 plus in terms of preventing hospitalizations. I don't think we have a vaccine that's working quite that well now, but probably it's working in the 80s, maybe high 80s. So, by nature of that, you're going to see more breakthrough infections than we had to begin with. The second thing, keep in mind that even in Houston, more adults than not have been vaccinated. So you have a bigger denominator of vaccinated people than unvaccinated. So you'll have, even if you had way lower rates of breakthrough, you'll sort of see more, sometimes a higher number because there's more people in the denominator. So for example, if you're looking at an 80-year-old, and 4 out of 5 of them are vaccinated, well, guess what? There's 4 times as many who could get a breakthrough infection as who can get a unvaccinated infection. So you have to keep that in mind when you hear the data. So I can tell you, we've been looking at this really carefully. And I feel right now, at least in Houston, I haven't seen others' data, but I think this is the strongest data out there. So about 1,000 patients now hospitalized that we've analyzed. Kind of other than the last day or two, there's about a 2-day lag. About the last 1,000 people have come in. So essentially all Delta variant patients, all of whom really coming in July. 82.5% are unvaccinated. So the vast majority of people getting admitted to the hospital have not gotten vaccinated. And we define that as fully vaccinated. I would have liked that number to be 95 or 98%, right? Not 82.5%, but it's still 82.5%. So the challenge we have is that the people who want to say, hey, vaccines don't work, like to glom onto a number like that and say, see, it wasn't worth it. And, we're looking at that saying that's not perfect, but it's one heck of a lot better than the alternative. In fact, that still ranks very highly in kind of the quality of vaccines, much better than a flu shot, for example. So when we parse inside those data, then really the question is, what do the 17.5% look like? Many of those people have transplant, cancer, the kinds of things that impair their immune system. And so the very people we need to protect, on average, they are much older. So the vaccinated population getting admitted is 69 on average. The unvaccinated population getting admitted is 51. I mean, so we're talking a dramatic difference. Now, there's kind of 3 reasons that could happen. One of which is, kind of what I was saying, which is we know older people have gotten vaccinated at a much higher rate than younger people, right? So by definition, the vaccinated population probably skews older. So there may be a factor of that, but that's not going to explain that big a delta. So really then you get into, did older people not get as well covered? Well, we know for a fact, no vaccine, including these, has quite as robust a response in an 85-year-old as it does in a 35-year-old. So that may be a factor. And then the other question is whether we may be starting to see some evidence of waning immunity. Remember, we vaccinated the old people on average before the young people. And so most of these people probably had their vaccine a solid 6-7 months ago. And so all of those are questions that we're trying to answer, we collectively, but we individually as well. We saw Israel last week decide to give boosters to 60 and up if they've been 5 months out. So that was the largest country until last night or so, or earlier today, I'm not sure which. Germany announced that starting in September, they're going to give booster shots. And I don't know all the details yet of how they're doing that, but it's going to be pretty wide open from what I understand. And I think Hungary, like a small country, has done that, and there'll be others. And so we'll see where the rest of those go. The US has not moved in that direction yet, but I will expect we're going to see boosters quicker than honestly all of us were predicting 60 days ago, when things were really good and we didn't have a Delta variant that was kind of dominating the landscape. So that's kind of the lay of the land. So the one last thing to comment on, and this is still very uncertain, but the CDC has been talking about masks again for everybody. Unequivocally, and remember, never was there advice that the unvaccinated go unmasked in congregate settings of any sort. They all did, because those were many times the people who least wanted to wear a mask in the first place, but never was that the advice. The advice was it was safe for vaccinated people to go unmasked. Well, now they've said everybody in these mixed settings, group settings, should be masked again. The reason is a couple-fold. One is there's a couple observational studies they've done where they're seeing big outbreaks, including some vaccinated people. Even if it's mild disease, they're getting sick, and they're seeing essentially high amounts of virus in those people, leading them to worry that those people could infect others. They don't know that as a fact, but they worry about that. So in other words, they're worried that a vaccinated person could infect somebody else. And so out of caution, which is, I think, appropriate, they're saying, let's just go back to masks. We know they work. And right now we're in the midst of a surge, and let's get things back in control. But it's still based on incomplete information at the present time. But again, very importantly, never did they say the unvaccinated should go unmasked. And so what I'm telling people is, look, in a low prevalence setting where, you're with a bunch of careful people, it's a small number of people, you're all vaccinated. I don't know that you need to go need to be wearing masks in all of those settings. But in large group settings, particularly large group settings where you don't know the status of everyone around you, I think everybody at this point should be putting back on the masks and the playbook of the past. Obviously, the governor has put some restrictions on all of that now that we didn't have before. In fact, we had a mask mandate before the last time we were going through a surge. So, how that uptakes in the community is, yet to be seen, and going to be problematic. So that's kind of the lay of the land right now. If I'm being candid, you're not hearing a rosy, sunny picture from me and my colleagues right now. I mean, everybody's a little scared of what we're seeing. It's gone up so quickly, so fast. I have a couple, like I said, tiny glimmers that maybe we won't see it go up quite as fast, but sometimes that's just a couple-day pause. I'm not ready to at all declare that. I sure hope in a week I'm sitting there saying, yeah, that was the early signal, but we're nowhere near that yet. And it has been honestly a very eye-opening rate of increase that we have seen here.
All right, so you got to at least hear and see some of these trends.
Well,
I mean, the thing that's interesting to me is at Methodist Hospital, the Texas Medical Center, which is is the largest medical center in the world, made up of MD Anderson, Houston Methodist, Memorial Hermann, St. Luke's, Houston Health, UT Medicine, Baylor Medicine. Well, what they're seeing is, like yesterday, on Monday, they had 269 admissions to the hospital, people with COVID, one day. And that's been the trend for the last week or 2 weeks as it comes up. I mean, so Sunday, it was 260 people admitted. The day before that, it was 260 people admitted. Wow. And on average, if you get admitted to the hospital with COVID, admitted to the hospital, on average, you're there from 6 to 8 days.
Dear Lord. Wow.
Was sort of the average.
Yeah.
Now, what's interesting, he said in the numbers, don't you heard, 82% of the people that have been admitted are unvaccinated.
Right.
And the average age is 51 years old.
That sits right in our sweet spot there, John, doesn't it?
Well, you're a lot older than
that
me.
means maybe the percentage is coming down for me, right?
But then 17%, as he said, are average age, that have been vaccinated, average age 69. That's a huge delta.
Yes.
A difference.
Yeah.
And he explained some different, what those people, sort of categories and all that. So it's just fascinating to me that I love this whole thing that in our culture there's so much arguing over masks and vaccines, and it's become so politicized.
Right.
Which I have a hard time understanding, like how it is that people get so angry over, being asked to wear a mask.
Over data and science and public health.
It goes back to this saying, it's like you are entitled to your own opinions, but you're not entitled to your own facts.
Yeah.
And what's hospital admissions?
Yeah.
They're going up drastically.
Yeah.
And Mark said later in the call, one of the things I thought was fascinating, and it really touched me, is he said, if y'all get the word out, let people know our medical staff, our hospital staff, really, really in a dark place, discouraged, despairing. They're not staffed at the levels they were last year, getting a lot of state and federal funding and extra staff. So they're having to work harder. And he's just, like me and you, we thought we were kind of coming out of this.
Yeah. Yeah. We're starting to take the victory lap a little, right?
Well, yeah, we were thinking about, hey, fall
fall,
kickoff,
come on.
this kind of stuff, and kids are going back to school, and no masks, and it's just, man, the hospital. I mean, our phase 1 ICU. So basically, all the ICU in Texas Medical Center is 100% full.
Oh.
And so then they create what's called a phase 2, which is they don't typically use, but they have at capacity. That's 81% full.
Phase 2 is 81% full right now.
So we're back at these numbers where we were last year when we were all like talking about how crazy, horrible it was. And this, now we're in this situation, but man, it's almost like everybody's done with it.
We'll just let people die off, I guess.
Like, and so in our state, you're not even allowed if a city wanted to do a mask mandate in Houston, they can't. They're not allowed to anymore. Last year, we had mask mandates in place.
Right.
Governor had mask mandates in place, and now we're like getting to a place where we're close to where we were then.
Wow.
Just from the data now. This is not like it just feels bad.
Because it doesn't feel bad, right?
It actually does not feel bad.
It doesn't feel bad.
It feels like, gosh, we're out on this. And then you start looking at the actual facts and the data, and it's different. We talked about a couple of other things that I think are interesting. One, we talked about, well, what do we do in churches? We just have to continue to really ask people, check their symptoms. If you've got any symptoms, even if you think it's allergies or something, you're probably best to stay home, watch online.
Right.
Your hand sanitation, doing all of that. And just go really strongly encouraging everyone to mask when they're in groups of people where they don't know the vaccine status of everybody. And it's really hard because just the way the nature of the world, to go back to say, we required masks early on, but we haven't done that in quite a while.
Right.
So now it just gets to be, gosh, I mean, like one pastor was saying that they have one of their services is a mask-only service. And another service is, optional. I don't know what the right answer is.
Yeah.
I'm still looking for the pastoring in a pandemic book.
Well, if anybody's going to write it, it's going to be you. I mean, I think that's the. I mean, right now we have kind of our transepts, which we ask folks to be distanced, and I've seen more masks the last couple of weeks in there. But then if you've been vaccinated and, you can feel free to sit kind of in the center,
I think there's some sense of self-policing that happens. So you saw in the spring, as the numbers were coming down after the winter surge and everything, even though we were strongly encouraging masking, really kind of telling people you need to wear a mask, people started taking them off, and we're kind of like, okay, this is good. We're getting there. And we finally got to a place where we're just encouraging masking. And then all of a sudden it was like, I'm free.
We're done. Yeah. Right.
And you're done with it. And then now you get back to this thing. So to go back to, it's like you're taking a step backwards. It's very demoralizing.
It is.
I think for people to think about doing that.
Yeah.
The other thing that we talked about is, what do you do about children? And he pointed us to the American Academy of Pediatrics. Mark says that that's his. How did he phrase it? He said that's who he would really want people to listen to, is the American Academy of Pediatrics.
When it comes to kids.
He said if you look at their track record, there's so much political stuff about the CDC. Yeah. Now people just think, oh, they don't know what they're talking about. He's like, they're discovering this in real time.
Yes.
And so, yeah, you're getting stuff moved. But he said the American Academy of Pediatrics actually last year, during the height of the pandemic, were telling people kids need to be in school. Kids need to be in school for their health and their well-being, their benefit. But you have to follow certain protocols.
Yes.
They need to be masked. They need to separate their desk, all this kind of stuff. So they were on the front edge of saying kids need to be in-person classroom, right?
Yes.
When a lot of it wasn't happening. And so he said when you look at them now, they're saying children under 12 need to be masked. That's what their recommendation is. And that's just another one of those really difficult things. Again, we're in a our governor in Texas has basically issued an executive order that schools cannot mandate masking for children. Mm. So even if you wanted to follow the recommendation, a school district would be hard-pressed to do it. And I think it's going to put, he's concerned that you're going to see outbreaks once school gets started.
Of
now,
course.
Fortunately, children tend to have milder symptoms. But he mentioned there's about 8 children at TMC right now in very serious condition with COVID. Now, that's not a lot. But, man, if it was my kid.
That's a lot.
It'd be a lot.
Yeah. And so we'll see an uptick of those, I would assume, when school comes, just being around each other.
Well, so this is happening now. We're doing Vacation Bible School with hundreds of kids running around. And I'm sitting here going, uh-oh. We're not doing anything wrong. It's just like, well, I don't know, man.
Yeah.
What's the answer? Where's the answer?
Yeah. Well, one of the things I know.
That's why I was discouraged when I said today I wasn't doing well. I'm just kind of like, it's roller coaster. Yeah, I was really feeling like, man, coming into the fall, this is going to be great. And some other things that I thought were interesting in the call is everybody says, well, when will the FDA fully approve the vaccine? Mark said he's really disappointed that they hadn't done that already. He thinks there's enough data for them to do it. And what's interesting, I didn't know this, I learned this from the call, is he said that because it's not approved yet, that they're what they call off-label use. I think it's what he called it. If doctors can correct me if I'm wrong. But basically, your doctor, let's say you have a transplant or you have immune system compromised, and they can measure like you're antibody resistant or whatever.
Right.
And they say, I think you need a third booster shot. Well, right now, because it's an emergency use authorization, they can't do that.
Oh.
They have to only give you the two, and then you can't get any more. Okay? But if it's FDA approved, then the doctor can say, I think we're going to give you a little booster. They could do that if you, in consultation with you, if you wanted to do that, if you were in that situation. And so then we ask, well, what about kids? When will kids be able to be approved to take the vaccine? He was saying that you've heard all this talk about the fall and September. He doesn't think it's going to be at least somewhere between December and February.
Wow, of next year.
Yeah, so December of this year to February of next year. I don't know the answer to that question. He just said it's going to take under 12 approval is not imminent. It'll be December to February, which then again it's going to put these school districts and parents in a difficult situation. So when you're talking about self-policing, the thing that I think is really unfortunate is that you have some states or some school districts that now are telling kids or families, you don't have the option to do online. You have to be in the school. And
you can't
wear a mask. That to me seems a little
obtuse.
Out of bounds.
Yeah.
Maybe I'm reading that wrong. But I mean, if you have a child who's got an issue, or maybe you just, he was telling me he has people at the hospital that are emailing him and saying, what do I do? I'm back at work. I got a 2-year-old and a 5-year-old and a 6-year-old, and they're going back to school. And they're like, what do I do? What do I do? What do I do? They don't know. Because they're scared, because they're in the hospital in the front line seeing this stuff, right? The hospital personnel. So yeah, it's going to be interesting. So we're going to continue to strongly encourage people to be masked up, and to just pay attention to the data. I mean, this is hard data that's right there at the Texas Medical Center that you can go and you can look at these numbers increasing dramatically.
I was interested in that. Is it the 7-day average? Just the marked increase of that, over the week, just seeing that kind of left to right and up, just moving. And so some of those data points are like, they're stark and scary.
Yeah, when you look at hospital admissions, so yesterday it was 260 some odd. A week ago it was 250. A month ago it was 50.
Wow.
So that's a huge difference.
So Marc really suggests that if you're in a place that you don't know if everyone's vaccinated, that you wear a mask.
Yeah.
Is that what he said? If you're like walking into a store.
He even said, let's say you're in a group, your Sunday school class or family group or your friends group, and everyone's been vaccinated. He said, you still have to have a conversation, because if there's someone in there that say have cancer treatment or, immunocompromised system,
right,
you don't just assume. You should talk to these people. These are people you supposedly love, have relationships with, right? So I think it's just, it's putting us in a position, in a place where we've never been before, dealing with something like this.
Yeah.
I mean, so I just, I wish people would be more understanding of people who, want to make certain decisions. There'll be a lot of self-policing. You'll see a lot more people wearing masks in a grocery store. You'll see a lot more people wearing masks in church. You'll see a lot more people taking precautions. And according to this, you should. I mean, I'm not as concerned being my age and relatively healthy. So when I look at the percentages, I still think as a vaccinated person, man, that it's like he talked about, you see these on the news, all these breakthrough. So whether it's Lindsey Graham or the rock and roll star or whatever, he goes, but these are very small percentage. I think it's like 0.07% is what we've seen of actual breakthrough infections.
Folks that have been vaccinated.
And it's like 0.004 hospitalized, and like 0.001 of folks who have died who have been vaccinated or something like that. So basically what that means is vaccine is 99.99999.
It's working.
Yeah.
It's working.
It's working.
And that's what I love about like your relationship with Marc Boom, is that it feels like we've got somebody that's an adult or who's kind of a non-anxious presence in the room, that's saying, here's what I'm seeing, and these are the steps that we can take just to take care of each other and to get out of the woods well.
Yeah. So I got to find something to cheer me up today. Don't know what it's going to be.
You want to go ride go-karts? No, you just got back from Disneyland, so that's probably not what you want to be doing.
No, I don't want to ride go-karts. You're going to ride go-karts?
No, I'm not going to ride go-karts. But I'd like to.
I'm thinking about it.
That'd be fun, though. I mean, something fast and a little gritty.
Yeah. I could just do that in my truck. You don't drive in Houston?
You drive it like a go-kart, don't you?
Way more. There's way more adrenaline rush driving down the highways in Houston than going to a go-kart track. I a go-kart track every time I get on the Beltway. Well, I got an email from a lady in the church, and she was just saying, hey, can you tell people, she goes, she's been vaccinated, and she is going to start wearing her mask again. And she's like, but, I get these looks from people, or people make remarks or whatever. And she's like, can you just, encourage people to be empathetic and loving? Yeah. And I'm like, I've been trying to do that for years.
You have been.
I mean, this past year, it seems like that's all I'm doing.
Yeah.
Is trying to just think about, I'll tell you the one, in thinking about that, this passage of scripture for Sunday really stands out to me. Paul writes in Ephesians 4, he says, so then, putting away any falsehood, let us speak the truth to our neighbors, for we are members of one another. Be angry, but do not sin. Do not let the sun go down on your anger, and do not make room for the devil. Thieves must give up stealing rather than let them labor and work honestly with their own hands. so as to have something to share with the needy. Let no evil talk come out of your mouth, but only what is useful for building up as there is need, so that your words may give grace to those who hear. And do not grieve the Holy Spirit of God, with which you are marked with the seal, the day of redemption. Put away from you all bitterness, all wrath, all anger, all wrangling, all slander, and together with all malice, put it all, and be kind to one another.
Yeah.
Tenderhearted, forgiving one another, as God in Christ Jesus has forgiven you. Therefore, we are imitators of God, as beloved children, and we live in love, as Christ loved us and gave himself up for us as a fragrant offering and sacrifice for God.
That's good.
And I think to myself, that's part of what we're going to talk about on Sunday, is that Christianity is not so much a set of beliefs that we hold to or propositions that we adhere to, but it's about the life we live. It's walking in deep connection with God as revealed in Jesus Christ.
That's right.
And so the way you behave, the way you talk to people, the way you act
it's a
that's
verb.
your faith.
Our faith is a verb.
Yeah, that's your faith. Don't tell me what you stand for and believe in, you know, show me.
Yeah. I love that. Be kind to one another. Gentle.
It still holds up, doesn't it?
It does.
After 2,000 years, we still need it. We hadn't figured it out.
Yeah.
I mean,
Yeah.
oh my gosh.
Yeah, that's right.
Well, I'm John Stevens,
And I'm Matt Russell.
and this is Pod Have Mercy.